Okay, as the city grapples with crime like that, critics are calling out a new public health campaign plastered on the subways. Take a look at one of the ads here. It reads, "Don't be ashamed that you are using, be empowered that you are using safely." We're talking about fentanyl here. The ad also advises people to never use alone. Take turns and go slowly. The city health department says reducing stigma can prevent overdose deaths, but critics say public health officials are encouraging and normalizing deadly and illegal drugs. We've reported just a couple of months ago, the city also opened its first safe drug sites where users can bring their own drugs and use clean needles. Republican City Councilman Joe Borelli is a critic of this new fentanyl campaign and joins us now. Almost hard to believe, but we put it there on the screen, and those are real signs on the subways here in New York.
Yep, those are real in the flesh. And to say we've come a long way from the fried egg, this is your brain on drugs commercial that we all grew up with, is such an understatement. We have a health commissioner right now that has his priorities absolutely backwards. This is someone who still puts masks on our toddlers, still makes student athletes not play sports if they're not vaccinated. All this because of a risk. And yet here we are urging people who want to use heroin or potentially would use meth or crack or anything to go slow, take turns, start small, you're empowered. This is the absolute wrong message in a city where drug use is on the rise, drug overdoses are on the rise, and we're doing exactly the opposite of what we should be doing. There
needs to be some sort of solution. CDC says and estimates that there were 107,000 drug overdose deaths in the United States last year alone. That was up 15% from 2020. As far as the health department, there's even coasters involved here asking using cocaine, fentanyl, a drug stronger than heroin, is being mixed into cocaine. It's causing a spike in drug overdose deaths. It's got safety tips on it. That is the picture there. But we are dealing with an incredible crisis. Do you believe that there is enough focus on it, and is this being taken seriously enough?
I think you're only seeing a renewed focus coming out of the pandemic as public health agencies like ours and like those elsewhere are starting to renew their focus on things they used to look at before the pandemic. And I'm not saying there's no role for these harm reduction policies in place. We don't want people who are going to use anyway to overdose. But when you're out there on a subway where New York City public school students take 500,000 trips per day, and you're using words like empowering to describe drug use, I mean, this is the wrong direction. We should be putting our focus on recovery and addiction counseling. We should be putting our focus on cutting off fentanyl at our border. We should be focusing on prosecuting drug dealers. All those things we've kind of abandoned and lost our way from.
If you were trying to see the other side of this, we know that a lot of first-time fentanyl use is because somebody doesn't know they have taken it, or they're just in the wrong situation, wrong time in their life, and then they get hooked on it and they don't know how to get on it. When you look at the New York City Health Department defending this as their Let's Talk Fentanyl campaign, trying to remove the shame from it, saying every 4 hours a New Yorker dies of a drug overdose, shame pushes people underground and shame is life-threatening. We want to fight shame and stigma. We want people to live. To your point about not wanting to encourage it, perhaps is there some room here to look at their messaging and say, perhaps something about this is right. We don't want those users to go underground and not seek help. They're trying to strip away the shame so that they come above and ask for it.
Well, that's why I'm glad you put the coasters up, because those coasters were placed in bars that have had problems with overdose, where we know, I mean, we're not prudes when we're dealing with drug use. We know this stuff happens. You're talking about bars where this kind of stuff has happened and has had a problem. You target those type of places. We have laws about naloxone being placed in those places. I think there's a lot of room for harm reduction policies. When you look at the downtown east side of Vancouver and you see rampant drug use all over the public streets, you see this crisis ongoing despite years of these harm reduction policies. I think those are the ones you have to pump the brakes on and say, what is the real societal benefit versus are we just allowing and encouraging people to continue their addiction?
Very interesting stuff. It's a huge problem. I know you've been focused on it for quite some time. The city's got to do something about it, and it's happening all over the country. Thank you very much, Joe. Great to see you.
Thank you.